When etomidate is the right choice. What's up, you guys? It's your ER pharmacist, Lil Pharma. This is part 3 of your RSI series. We're talking about induction agents and when etomidate is the right choice. Etomidate is very predictable and hemodynamically stable. So if you're wanting to avoid large swings in blood pressure, etomidate is the right option for induction. Traditionally, it's been used in traumatic brain injury and stroke to avoid an increase in the intracranial pressure. At this point, we know we can still use ketamine, but if we're still worried about that increase in blood pressure, maybe they have a really high blood pressure already, I would lean towards using etomidate in that situation. One important pearl, etomidate does cause adrenal suppression. So if you know your patient is already in an adrenal crisis or some sort of shock state, maybe even sepsis, it's something that you should pause and think about. Now, the literature doesn't necessarily show a clear increase in mortality with etomidate in patients with adrenal insufficiency, especially with one dose. It's a really hard thing to study because if you're intubating the patient, you're obviously going to give them a lot of medications after. They're obviously really sick. So that one dose of etomidate is really hard to tease out and say that that is for sure what's causing problems. But we do know that it does cause a bit of adrenal insufficiency. Use etomidate if you're worried about hemodynamic changes, large swings in blood pressure. Don't use etomidate if you know that the patient has adrenal insufficiency. Next up, we're going to talk about ketamine and when ketamine is the right choice for induction. That's all I got for you. Bye.